When treating epidermolysis bullosa in children, one factor must be the absolute focus: pain. The daily experience of a child with EB is often compared to that of a severe chronic burn victim. For them, routine care like changing a bandage becomes a source of excruciating procedural pain. And this pain isn't just skin deep, it's internal, affecting swallowing and joint movement. We will show why pain management is the prime focus by revealing its complexities and the strategies required to fight it. So, how does this constant pain affect a child? It severely degrades their quality of life, stopping them from taking part in normal childhood activities. Then there's the relentless itching, which some rate as even more distressing, that creates new wounds. And this suffering is hard to manage because it's difficult to even assess, especially in pre-verbal children. The stakes couldn't be higher. Poorly managed pain in childhood does more than cause immediate suffering. It can lead to permanent changes. This begs a question: what makes EB pain so fundamentally severe, right down to the genetic level? To understand why pain is the central issue, we have to look deeper at the biology and neurology of EB. The answer begins with the genetic defect. In some EB forms, a deficiency in a protein called laminin 332 doesn't just cause blistering. It also directly contributes to heightened pain sensitivity. This means the child's nerve endings are wired to overreact to any touch. This leads to a second layer: neuropathic pain. Up to 75% of patients feel this burning, shooting sensation that ignores traditional painkillers. The brain adds a third layer: conditioning. Children learn to fear the pain of procedures, a response called anticipatory anxiety. This fear is physiological, releasing stress hormones that significantly amplify the actual pain they feel. The dread of pain makes the pain worse. So what does this combination of physical, neurological, and psychological pain look like for a family? Take a daily dressing change. For the child, it is a moment of predictable, intense pain. They are acutely aware of what is about to happen. For the parent, it's an agonizing task. They feel profound distress and guilt, having to inflict pain on their own child to provide necessary care. This daily ritual becomes a source of shared trauma for the entire family, what clinicians call pediatric medical traumatic stress. This immense suffering is clear. So why is managing it so incredibly difficult for medical teams? The first challenge is a shocking gap in care. Despite the severity, a substantial portion of EB patients are undertreated for their pain. For those getting treatment, strong medications like opioids present their own issues. Daily use often leads to tolerance, requiring higher doses. Treatment is also complicated because pain sources are a moving target, from skin lesions to constipation or even corneal abrasions. And a failure to manage this has permanent effects. Unmanaged childhood pain can alter brain development and wire a person for lifelong chronic pain. Given this overwhelming high-stakes problem, a simple prescription is not enough. So, what is the answer? The answer must be as multifaceted as the pain. The best strategy targets the genetic, neuropathic, and psychological layers. It is a biopsychosocial method. This method must be proactive, not reactive. Treating pain before it intensifies is necessary to prevent the anxiety cycle and long-term brain changes. It combines physical tools, like non-adhesive dressings that minimize trauma, with psychological interventions like guided imagery to manage anxiety and itch. Ultimately, this proves our central point. Treating EB is about more than just healing wounds. It is about actively managing pain. We've seen that for children with EB, pain is not a symptom. It is the central experience of the disease. It is severe, genetically amplified, and neurologically complex. Therefore, modern EB care must prioritize creative non-drug strategies. Distraction with virtual reality and therapeutic play are frontline tools, not optional extras. This is paired with a foundation of pain prevention. Using specialized non-adhesive dressings is an active pain management strategy that minimizes trauma. The goal of EB treatment must be more than skin deep. By placing pain management at the center of care, we don't just treat a condition, we fight to restore a childhood.